When we take any medication, the hope is that this medicine would alleviate any pain and suffering that led us to take the medicine in the first place. But this is not always the case. An allergic reaction to medicine, for example, may cause more harm than good. My name is Dr. Mercy Korir, and on this episode of Health Digest, Beldin Waleula brings us the story of one such woman who had a severe allergic reaction to a prescription medication, and this reaction almost cost her life.
Christine Hannah Gitaka is a 39-year-old woman from Muranga. She's recovering from Stevens-Johnson syndrome, toxic epidermal necrolysis, commonly referred to as SGS-10, after reacting to her prescribed medication. She vividly remembers how it all started.
I was once involved in a road accident about 12 years ago in December 2009, which left me with a condition because my head was hard hit. I was left with a condition known as epilepsy. I'm classified under epilepsy because I suffer convulsions and seizures. So from there, I had to be put on anticonvulsants, and I've been on anticonvulsants since 2010 to date.
In late 2020, she suffered convulsions, and her doctor decided to increase her dosage of anticonvulsants.
A couple of weeks later, I first had a small blister on my heel where I once had a scar. So when I went to the dispensary around my area, they concluded it must have been an infection on the scar, and I was given an antibiotic. But later is when we came to learn that it was actually not an infection. It was the first symptom to a serious and fatal problem. So the first injection, I was given the first injection, and I was told to go for the second one the following day. But on the following day, I had a skin rash. The whole body had a skin rash, and the blister had turned black. So the doctor in the clinic realized it was actually a reaction. It wasn't an infection. And immediately called for an ambulance, and they brought me to Nairobi for better care. Because he actually told me this might require ICU. And I could not understand how just a simple skin rash would require ICU. But by this time, I could not even eat or swallow because I had blisters in my mouth. My throat was painful. The skin was painful. So yeah, I ended up in HDU. Actually, when I was received in Nairobi, I was received in Aga Khan Hospital. I was taken to HDU. The skin had it was like a simple rash, but it was all red, and I'm very light-skinned, so you could actually see it so clearly. It was all red, and it's from top to bottom, from my face to my toe. Yeah.
And it was painful?
It was painful. I understand it was painful. I actually, because I got to a point of being in the ICU, when I woke up, I could not remember the pain. I was being told that I was in extreme pain. Yeah. Pain that even the doctors, the strongest painkillers they tried could not work. That's why they put me in a coma.
In no time, her condition became life-threatening. That her recovery is considered a miracle.
The problem was they could not actually determine what exactly I had reacted to. I've been on this medication for this long. They would not expect me to react to it. And then I had been given an antibiotic. So the first assumption was that it was the antibiotic. Although I kept telling them that's the antibiotic I've always used. So I didn't expect also to be reacting from. I actually didn't even know you could react to a drug that bad. So they put me in HDU. And after some days, the condition got worse. Actually, I looked as if somebody had poured acid on me. And this is from face to toe. It was actually concluded that my burns were over 90%. And this is something that people hardly survive.
Dr. Felix Riunga, an infectious disease specialist at Aga Khan University Hospital in Nairobi, explains that SGS-10 is a condition where with a certain trigger, the body starts attacking the junction between the cells in the skin, leading to the loss of skin of a larger surface. Not only the skin is affected, but also the covering inside the mouths, the digestive tract, coverings of the eyes, and sometimes the reproductive tract.
Initially, what it looks like is like blisters. So what most people notice is that they've developed new blisters, which come on the hands or the face or the legs. And the problem, what happens is that they start moving quite fast, so that if you only had a small portion that was there, a few hours later you find that there's more involvement, and then in a matter of days you have, if it progresses, you have quite a wide spread area of the skin involved.
So apart from the skin, do you have any early symptoms?
So the earliest symptoms are actually on the skin, and it's usually the blistering rash that we see. And that is always an alarm. Yeah, so if one has taken, for example, a new medication and they notice that there are blisters coming, this might point to an allergic reaction, like what we are having here. And then subsequently that serves as a warning so that one can go and see a doctor and monitor. Yeah, not all allergies progress to that extent. Yeah, some are much milder, some present in different ways. But for this particular one called SJS or TENS, then it's much more severe and needs observation in a hospital. Yeah.
Christine's skin started tearing and peeling off, and she stayed in the ICU for 6 weeks. She was unable to control how much heat or cold she could experience.
So when she put me back on bed, my back tore. Literally, my skin on my back, iliraruka, yeah. So I think that, I can't remember much after that. I think it was extreme pain. I can't remember more about that. Yeah, but it was really bad. The skin peels off, it tears and peels off. Yeah, I woke up from a coma and I could not even remember what had happened. I couldn't understand what was happening to me. But now I can remember the kind of pain I would experience when they were bathing me and all that, because this time I don't have any skin on me. It was tearing and peeling off. They would pour oil on me, paraffin. It's called liquid paraffin. They would pour it on me so that the skin could peel off. So at some point I had no skin at all. So at this point, I cannot control how much heat I experience, how much cold I feel. Kukiingia baridi, when it's cold, I'm freezing and shivering. When it's hot, I feel like I'm burning. So it was really a bad and traumatic experience in ICU.
She adds that her family and friends were more traumatized when she was. She gets overwhelmed by emotion when she recalls how her family never left her side as her life hung on the balance.
Coming to check on your loved one, you're told you cannot see them today. This is when COVID was at peak. So they could not even hold me, hug me, touch me. It was 1 meter away, because even my skin was prone to infection. So I was actually in ICU and isolated. From what I would get, at least only my sister-in-law was allowed to come in every day. So it wasn't easy for them. It wasn't easy. Before I was put in a coma, they told me I was in so much pain. I was in so much pain.
The condition left her with a blind left eye, and her skin is still regenerating from the effects of SGS-10.
This condition, when it hits hard, you suffer, in most cases you'll suffer eye issues. The skin, of course, you can see I'm still on recovery, but all these parts were like this, so it's coming back slowly by slowly. But I lost sight, my left eye doesn't see.
Some of the effects took long to heal, and she had to go through many physiotherapy sessions to regain strength, as all her muscles had weakened after being immobile in ICU for a long time.
After being in the ICU for that long, all my muscles were dead completely. I could not even lift a finger. I could not sit. I was like a 3-month-old, the way you put pillows on their sides for them to sit. Yeah, so it was therapy to bring me back to what I am now, which I'm still having therapy even now. Lots of medication, lots of skincare products. Yeah, that's what I've been having for almost for over an year now.
After close to a 3-month stay in hospital with a bill of 11.5 million, the hospital reasoned that she could get the remaining care from a nursing home at a lower cost. Christine had hope that she would make it, as she had been in an almost similar situation after the accident 12 years ago.
It was really difficult. There are things you take for granted. When someone tells you, I can't sit, and you just assume as simple as sitting. And from 1 minute you can sit and walk, the next minute you can't even lift a finger. The things, for now, for me, I could imagine because I had been in it before, but someone you're telling a story, they would not understand.
But what gave her the fighting spirit was her supportive family and friends who are always there for her.
I have the best family. I have the best family. Call my immediate family, talk of my in-laws, talk of my friends. They've all been so supportive. And I always tell people, whenever I'm interviewed or whenever I'm talking to somebody somewhere, I normally emphasize on support. Family and friends support are everything. Yeah. So it has been good. Actually, my mom moved from, our home is Nakuru, and I live in Muranga. From the moment I fell sick, from the moment I was in that hospital to date, she's been staying with me just to give me support. My brother cannot go for a month without traveling from Nakuru to my place in Muranga to make sure I'm fine. Yeah, I consider myself as normal as before. Yeah, I think I'm almost back to normal. I may have forgotten a lot of details, even in terms of my own life, in terms of work, but right now I consider myself okay. I consider myself okay. I still have a lot of hospital reviews, but being able to walk and work, I resumed work in September. Being able to work and walk and do everything that everybody else does, I wouldn't want to let anybody down by saying I'm not okay. I'm okay.
Dr. Yunga explains that most of the SJS triggers are medicines. The immune reaction is referred to as type 4 allergic reaction, where the medicine taken starts producing substances that cause skin breakage.
It's unpredictable. So one of the things to say about this, it's unpredictable. You cannot know beforehand that you will react to this medicine, and that's why it's such it's a condition that is hard to manage. So what happens is that we once the medicine is taken, is the only time that you can see whether this condition develops or not. Yeah. That said, there are certain types of medications that have been more involved than other medications. Yeah. For example, medicines that contain sulfur drugs seem to have to be represented a lot more in the research than other kinds of drugs. Some kinds of anti-epileptic, anti-seizure medicines have also been implicated.
The severity of the disease depends on how much is involved. If one has less than 10% of the skin affected, then they call that Stevens-Johnson syndrome. When the area of the skin affected is more than 30%, it is then referred to as toxic epidermal necrolysis.
Once you reach to the area of TENS, where you have more than 30% of the skin being involved, and this involvement of the coverings of the eyes and the digestive tract and so on, then that becomes a very severe thing, which can actually lead to death. It is actually it acts the same way as someone who has gotten burns. Yeah, so if you've been burnt over a large body surface area, then the kind of complexities and complications we experience in burn patients are the same kinds that we see in people who have this condition.
SJS-10 is a painful condition due to the numerous nerves on the skin, and when blisters occur and there is loss of skin, then one will experience extreme pain. Dr. Yunga advises that the only way out is not to take any unnecessary medicines.
We like to go taking over-the-counter medication, unprescribed medicines, antibiotics, even when they are not necessary. We have a culture of taking a lot of medication that is unprescribed and over-the-counter. But we always know that medicines are not harmless, yeah? And so one easy way is just trying to minimize taking any medicines that are not necessary. Of course, beyond that, it's very hard because it is unpredictable, so it's hard to prevent it, yeah? There is no cure as such, so a number of therapies have been tried, but none are very convincing in terms of the ability to have a cure. So the data has been mixed in terms of whether they are effective or not. Yeah? What we do is support the person as we wait for their own skin to regenerate. Yeah? That's all one can wait, because at some point the allergic or that immune process will stop and the skin will start regenerating. New cells will be formed. Yeah? The challenge is making sure that the person affected remains alive, actually, during that whole process. Yeah? Yes.
The biggest challenge is the skin takes time to regenerate, and since the skin is one of the first defenses against infection, once it peels off, it leaves one susceptible to infections. A patient also ends up losing a lot of water as there's no skin to lock it in, and one has to keep replenishing the fluid. Temperatures are also unbearable.
What keeps one in hospital, beyond the waiting for the skin to repair, all these other complications that arise, because they must be dealt with as they come.
The body also heals with scars, and the eyelids, for example, can fuse. The condition, however, is not contagious and cannot affect those in close contact. It may reoccur if the drugs that cause the reaction are consumed again.
Quite difficult, yeah? Because one, the skin will heal and it can scar, yeah? So you don't look like you used to before. One doesn't look like they looked before, and that's a big complication to deal with psychologically. Yeah, I think we can't downplay that. Yeah, other things you don't even think about. One of my patients told me because they lost their fingerprints. Yeah, even using their smart cards or other things that require, thumbprint identification, that is gone. There's rearranging all that. So, but even beyond the cosmetic part of it and the psychological aspect is other things, like now if your eyes get destroyed, because they're not destroyed as such, but you need a lot of corrective surgery to keep to make sure that the eyes remain open. If other areas were involved, like the urinary tract or the reproductive tract, and they fused together, then those are surgeries to try and keep them open. Yeah, so it's something that has a lot of complications even after healing. There's a lot that one has to deal with. Yeah?
People go over the counter and pick medication anyhow. Now for me it was actually a prescription, but that's when I tell people that medicine is meant to help, but sometimes it can kill you. And in case you see symptoms 1, 2, 3, run to the doctor, you see. So if somebody asks me what happened to you and all that, I take my time to explain to them.
Well, you can now tell that medicine is not food, and we should only consume what has been prescribed to us and what is necessary. Belden, Waliaula, KTN News.